Headache, drowsiness, you're going to see the patient have. Because CSF has to do with balance. Right? Make sure you know that. While you're doing that, you're watching the back to make sure there's no leakage. While you're doing that, you want to look the color of the fluid. Anytime after a lumbar puncture, the patient will always have a headache. You go call the doctor, he's going to cuss you. It is normal that after a lumbar puncture, the doctor order Tylenol for the patient because the patient will have a headache. And another thing too, you make the patient empty their bladder before, because after the lumbar puncture, you don't want them to walk because they will be what? Dizzy. You got that? Any question? So you go to NCLEX and they ask you, lumbar puncture. Are you going to go, what? You know. You go to NCLEX, they ask you EEG. You going to go, what? Okay. They ask you about meningitis. You know meningitis go to ICP. ICP go to what? Seizure. Any question so far? Right? After the lumbar puncture, why are you going to give me fluid? To replace. Yes. After a lumbar puncture, are you going to monitor my respiration? Yes. Remember, aiguille. Are you going to check me for fever because I stuck aiguille? Right? Any question? Encourage fluid. Monitor intake and output. Any question? Let me ask you a question. If I say something food for a meningitis patient, if I say, what food you going to give Parkinson, meningitis, is the food has to do with the test or the food has to do with the disease?
With the side effect.
I'm giving you an example. Listen. Let's use Parkinson, because meningitis is kind of crazy. If I say, a patient with Parkinson, you need to give them pureed soft food. Why do I have to give them that type of food? Is it the test? No. Or is it the disease? Okay. The disease. Now, if I say the patient with Parkinson is on Simitrel, which food I'm going to give them? Is that the question has to do with the disease? Or the medication? Because the medication causes constipation. There you go. Comprendre. Did we get that? Okay. You see how easy nursing is if you understand.
I'm proud.
Any question? Okay, now let's go to CT scan, which is on page 808. Right? CT scan is a type of brain scanning that may be done with a dye or without. The purpose of the dye is to see it pretty, to see it magnified. You see how I could blow y'all up in this room? This is how we do when you testing. We'll take one student and blow her. If we suspect her cheating, Miss Carol just blow her all up. Bam! That was a joke. Oh, stop it. Oh, y'all have no sense of humor. What a clap. No, y'all, new Wednesday, Thursday, y'all not my favorite no more. Sorry. Y'all not fun, y'all. Y'all getting too serious on me. No. I can't even crack a joke. Kilo febi, right? Okay, so CT can be with a dye, without a dye. So remember, so if it's a dye, you will need a consent. Make sure you know that. Okay? Ready? What is the job of it? It is used to detect intracranial bleeding. Anything, any deformity. Okay? Pre-procedure, you need a consent. because of the dye. Are you allergic to any iodine? Look, now, look, shellfish. Now, when your papa mette shellfish or dye, they use other stuff. Mussels, get all the mussels. What mussels is? Mussels is the little bon. You met the girl when they put mussels. She say, bless her heart. Miss Sonia, what's mussels? Dit petit son bay bon blanc yo manger, bon manger, bien cher mussels. Rich people food.
Yeah.
She was like, Miss Sonia, but mussel, qu'est-ce que mussel here? If I mussel, she said mussels are no, it's a type of. Yeah. Mussels. On bagay it's like shrimp, stuff, scallops. Sometimes they put scallops, they put stuff like that. Right? She say, I don't know, but I know it had something to do with dye. Pour dire, pour elle anglo, parlons, sous comprendre, you still can pass the test. She say mussels. Mussels, samedi, no, about mussels. All right. Okay, so let's continue. Pre-procedure consent, shellfish. Instruct the client on the need to lie still and flat during the test. You see a diamond, highlight that. Instruct the client to hold his or her breath. Initiate IV line, yes, if the dye is given. Yes, make sure you know that. IV. Okay? Remove objects from the head, wigs, barrettes, earrings, hairpins, and medallions. The cross. You gotta watch that. NCLEX very big on questions like that. Okay?
So, Miss Sonia, when they are asking stuff like that, so they're not even in the book.
Not in the book, but comprendre. It's not, listen, that's what I just said. Listen, it's not in the book, but you must know, but what did I teach you? Allergies. Shellfish allergies. C'est comprendre, baby. That's why pas tout le monde. That's why not so many people can pass the test. Go comprendre. I understand you don't know what mussels is, which she didn't, but she did comprendre shellfish, the dye. So she told me automatically, but Miss Sonia, mwen muscle mbawe lot bagay m'tou pray because the other ones didn't make no sense. So when your English is not long, your comprehension must be long. And that's why when you studying with a student, and if the student take 10 days to read one section, don't get mad at them. They trying to understand it. That means you cannot study with that student. And I'm going to tell you, the way to pass the test is to read the book 10 times. Don't let nobody telling you read too much. You know who failed? The one we got all the English and just skim. Skim mean passer. Ou gen anglais. Passer, Tesla, passer devant. You can't pass. Right? Don't skim. Read the book. It's okay to be slow. Pour qu'ajon un bon résultat. Okay? Let's continue. Where am I? CT. Okay, so we said die. Assess for claustrophobia. Stop. This is on my mama papa. Now, the book say claustrophobia. True? What does claustrophobia? Small. On my mama papa, let me tell you what I put. Put the patient close to the wall. Isn't that claustrophobia? Yes. Boom, I get you. On my test, you come back, you say, that don't make sense. I say, open your book. And you see claustrophobia. You say, oh. Guys, if you take me, you stick me close to the knee, isn't that a form of what?
Confinement.
That's what on my cardiorespiratory neuro mama papa. That's what is it. I put take the patient, stick close to the wall. You get so mad at me. Oh, that's not what the book said. I say, hell, open the book. Oh, they said, oh, same thing. Right, Susan? Same thing. Isn't that the same thing? Hmm? All right. Let's continue. So make sure it says for claustrophobia. I don't have to put claustrophobia like that. Inform the client possible mechanical noises. Yes. Cloak, cloak, cloak. Not only for MRI. The school taught you MRI, but you can hear noises for CT and MRI. A lot of diagnostic tests. You hear when it changed to different tissues, different organs. You hear cloak, 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 cloak. So sometimes you put something on the patient, not any, but the plugs. Okay? Now, ready? Continue. Inform the client there may be a hot flush sensation because of the dye. Note that the client may be given the dye even if the report an allergy and are treated with what? Antihistamine, which is what? Benadryl. And where did I teach you Benadryl? Med-Surg respiratory. Huh? And I talked about it in anxiety. Okay? Now, okay, here it is. If I'm going to do a CT scan and I have diabetes, CT scan, you need to give me IV. What are you going to tell me about my metformin? Do you know I also have that question on my mama papa? I always give the students. You know why? Because you say, what CT scan has to do with diabetes? AIV liquids, right? IV, needle, cause what? Bleeding. Metformin, diabetic medication, cause bleeding. Do you see where the comprehend come in? That is on my mama papa. About when you're going to do a CT, you will hold the diabetic medication because of the what? IV. But watch I get somebody on my mama papa. And remember, half of my mama papas, I give you the answers in class and teaching, but we still get them wrong because students just get them wrong. Okay? Post-procedure, fluid. Why you going to give me fluid? That's right. So after a CT scan, I tell you I didn't pee, I didn't poo-poo for days. What would you do? Call the doctor. That means the dye is what? Still in. Okay? Now, monitor for allergic reaction. Monitor for dye injection for bleeding, hematoma. Monitor for extremity. So look. After a CT scan, which is priority? Which is priority? Checking for neurovascular, patient complaining of an itch, doing vitals. Which is priority? After a CT scan, priority is vitals. Be careful. Shh. Vitals. Be careful. Let me reverse it. Which patient you going to see first? For these patients, well, this one patient, these patients have had a CT scan with a dye. Which patient you going to see? Which is priority? One patient who tell you they cannot move the leg, right, or the arm, or the patient that tells you I'm itching nonstop. Itching. Isn't the one can move good too? Yeah. Yes, it's good, but out of the circulation and the itching, which one is priority? Itching. Because the itching from airway, that's where. You see how I got you? Anytime after a procedure, priority is vitals. If I want you to go to where you went, I have to put it in the question. Don't forget that. All I said, anytime after a procedure, priority is vitals. You got it, guys? Stay focused on the prize. You'll make it. Some of you guys looking at me like, okay, any invasive procedure. Let me explain something to you. She came and have a procedure in the operating room, right? Very important, guys. She did the procedure. Operating room, step down, floor. Operating room, step down, floor. What tool do I use to take her from operating room to step down? If the vitals is no good, she stayed right there. That is why any time after any procedure, priority is vitals. If I want you to go airway, mete something else in the question. For example, the patient had a bronchoscopy. After a bronchoscopy, priority is vitals. The lady had a bronchoscopy. The lady asked for lunch. If I want that response, I'm going to ask it in the question. And that's why test-taking strategies is so important. You see, yesterday what I gave you guys, it beat a lot of you guys. And I saw that, and that you need to fix the problem. If I want you to go circulation, if I want you to go airway, I'm going to put a key word. That's why Kaplan teach you. Look at the content and find the key word in the question, because the question directs you to the answer. And when we doing question, all you see Parkinson, and you go get. No. Parkinson, pa. Where the other papa? You gonna take Parkinson plus the pa to answer your question. You need this too. But you guys, right when you see Parkinson, bam, you take. Why? What happened to the other piece? The patient had Parkinson, have lost 20 pounds in 2 weeks. Hey, baby, Parkinson lost 20 pounds. They go the other piece. When you put these together, that sends you to the answer. This alone don't give you the answer. And that's where your problem is. That's why when I do test-taking strategies, I say, hey, Parkinson, whatever, what system? You say, med-surg neuro. Then I say, what's the keyword? That's where I get you. I ask you for this other piece for us to come up with the answer. You got it, guys? Open your eyes. That's the key to the license. You got it? Okay. All right. So post-procedure, provide fluid, monitor allergic reaction, assess dye. For hematoma, so isn't it fair after procedure you're going to check H&H for hematoma? Monitor for colors, warm, presence of distal pulses. Any question? With meningitis, okay? Now, let's go to, so meningitis, I did the disease, side effect, I did nursing intervention, machine test, blood test. Meningitis, really, medication, antibiotic we talked about. Food doesn't apply with meningitis. Yeah, but really, a little bit it does. You got to, because the patient have bacteria infection, you got to make sure stay away from salad, bagay, raw food. So you see that? Then we talked about the diagnostic test. Any question? So let me start Parkinson. So we back to page 830. Actually, it's not Parkinson, it's West Nile virus. West Nile 829. 829. We going from back to front. Okay? West Nile virus. West Nile virus is potentially a serious illness that affects the CNS. The virus is contracted primarily by mosquito. So listen, I cannot isolate Tom from me. You see that? Because how did Tom get it from what? Mosquito. For me to get it too, I have to get bitten by the what? Mosquito that bit Tom. So when the students say, what isolation? So you can understand, does the crime meet the punishment? Right? How can you say Tom need to be isolated because he only have it? No, he needs to be isolated from the damn mosquitoes. So you're going to teach Tom to stay away from swampy water. Tell Tom to use deep off spray, begod spray, use net. But you cannot tell Tom stay away from me because Tom caught it from the mosquito. In order for me to catch it too, I'm going to get it from the mosquito. All right? Stay with me. That's West Nile virus. Now, the virus is contracted through mosquitoes. Symptoms typically develop 5 to 14 days. Neuro effects can be permanent. Yes, Tom, if we don't fix this, Tom can automatically have neuro issues, seizures with this wet. This is a very serious problem. That's why mosquitoes, every time during the summer, anytime you see a whole lot of mosquitoes, they close the area and they start spraying. That's very, very important because of this. Okay? Now, data collection, which y'all call what? Sign and symptom. Okay? Ça veut dire, moun nan, right? Ki mayen gwen sa mode moun sa. Me so ap we. C'est ça yo les sign and symptoms. Okay? What I did, I just told them what sign and symptoms mean in Creole. You will see fever, headache, body ache, nausea and vomiting. Yes, swollen gland, rash, severe symptom, high fever, stupor, seizures. Intervention or supportive measure, there is no treatment for the virus. There is prevention by teaching her to stay away from manguen, from mosquitoes. Once you have it, there's no treatment for it. Now, prevention. Deep spray, off spray. Now, here it is. NCLEX don't put deep, they don't put off. They put this big word, which is what? Organic chemistry. N-N-dimethylamide. This is the ingredient in off spray. Off spray. Begon has an ingredient that kills mosquito. This is it. NCLEX don't have to put off. They don't have to put bug spray. Okay, let me ask you a question. NCLEX, they have these questions. They give you 4 groups. Who's at risk for this? School age kids, 78-year-old people, the 40-year-old mother, and the Boy Scout. Why? Because they go run in and Okay, so si comprend nou valage. Because Boy Scout is exposed to what? Where they have mosquitoes. Sure, you understand that. So you gotta put your thinking cap on, right? Now, turn. Wear long sleeve. This was my NCLEX question. It was so easy. Long sleeve. Child, they just gave me a test. Long sleeve, light colored clothes. Why not dark clothes? It attracts. Good job. Stay indoors. Ensure mosquito breeding sites are eliminated, right? Such as standing water. Keep watering pools empty. Wear a lot of water. Wash the pool. Get the pool clean so that green stuff don't sit in. So, NCLEX going to ask you a lot of questions about prevention because there is no treatment. Okay, now.
There is a prevention they asked me when I did my LPN.
LPN?
That was, I don't remember because that's a long time ago, but I remember that
Repellent.
Yes.
Repellent is off spray. Repellent. Yeah, they put anglais on code. Repellent is bug spray. Off spray. Yep. So guys, it's not about the English. Right? And I told y'all, so Delia was my first student that went to NCLEX. She was the first student I sent to NCLEX. When I prepared for NCLEX. And she cried in McDonald's parking lot. Right, so Delia? Yes. You remember. But Pajot dit I will get licence. Yeah? I always remember that. I got to put you on my website, so Delia. Okay? Okay, any question with West Nile virus? Okay? Listen, we're going to, let me continue I got 6 minutes. I got a board of nursing conference call meeting from 10:50 to the break. Please, I cannot talk, so I have to be sit in and listen in. All right, guys? So anything you're going to tap me got to be when I come back. I'm going to get out at 11:30 on the dot, but I got to be present. So I'm just watching for 10:50. 5 minutes. Any question? Now, then we're going to do ALS. I got one disease that I'm going to do in 5 minutes. Amyotrophic lateral sclerosis. I'm on page 828. Now you're going to say, Miss Sonia, why don't you do encephalitis? Because once NCLEX asks you meningitis, hardly ever they ask you encephalitis. You know because it's the same thing. Right? One, inflammation of the brain. One is inflammation of the spinal cord and the brain, which is meningitis. Okay? Now, ALS, right? Everybody watch Empire. That's the one that Lucius was supposed to have. Another name for ALS is Lou Gehrig disease. ALS, anytime NCLEX asks you these questions, it has something to do with DNR. ALS, you don't live 2 years. You don't live a year. Hell, if you're a good person, maybe you get a good 8 months. ALS, you will die very quickly. It is a muscle weakness of every part of your body. You will die, so be careful. It's not a disease like AIDS, where it's tertiary management, right? As long as you take your medication, you can live. So focus on DNR, which we'll learn that in laws, right? So let's go. It's also called Lou Gehrig disease. It is a progressive, degenerative. That means more. I want you to put mortality. But there's no tomorrow. Just go buy your casket, plan it. Now you plan your wedding, plan the funeral, right? That involve motor. Motor only means weakness, muscle weakness. This does not affect the brain. You will never have LOC because it only affects muscle. That's on my mama and papa. Now, sensory and automatic systems are not involved and mental changes do not result. The cause is related to excess of glutamate. Miss Sonia, what is glutamate? Glutamate, dopamine, serotonin are they call them chemicals in our brains. So sometimes the patient can have a chemical imbalance, which is schizophrenia. So this patient, the problem is in the brain, right? Glutamate is affected. However, the brain is not affected, only motor. Côté muscles, muscle here, muscle, wherever muscle is. He said, boo, he faint. He go in the bathroom and number 2, he faint. And he talk weak. He can't even look at you because you got muscles. So that's why death soon occur. Okay? As the disease progress, muscle weakness, atrophy develop, the patient become flaccid and a quad. Eventually, the respiratory muscles become affected, leading to respiratory pneumonia and die. No cure. It's not like MS. MS is baby compared to this.
Is there a difference between
Yep.
Alzheimer's?
Well, yes. Alzheimer's has to do with brains. Sa is motor, muscle.
Because I see the progress is
The reason, no. This ALS has to do with muscle. Alzheimer has to do with more mental. Ça par un class mental. I can talk to you and have a good philosophy conversation and have ALS and die tomorrow. Because every time I talk, which takes muscle issue, okay, that has nothing to do with Alzheimer's. Non, ipalada. Ça c'est motor, muscle. Ready? Fatigué. While talking, ou fatigué. Isn't that sad? Yeah. Respiratory distress. Tongue. Bon, wait, listen. If this tongue, you dead. God, imagine mine was like that. You know I talk about dysphagia. Pas qu'à manger. Weakness of the hands, nasal quality of speech. You parle on the yes, nose. Right away, plan it. Hell, you know how you plan a wedding? You'll be planning a funeral. Yeah, so you know they're gonna hit a DNR on you. Something with rights. Look. Care is taught to treat the symptoms. So if he have pneumonia, they'll give medicate antibiotic, but ain't no cure. Right? Monitor for respiratory, provide respiratory, assess complication, provide client and family with support, more dead. Any question? All right? So look, we're going to take a break.